And so the weathering effect is it describes how chronic exposure to social, economic, and racial stressors lead to premature aging and increased vulnerability to disease. And so when you think about African American, Black populations, and other marginalized populations, that effect is cumulative over a lifetime. So again, when you've spent your whole life having to deal with systemic racism, dealing with these social determinants of health, then it's kind of like this cumulative wear and tear on your body.
It's wear and tear.
It's wear and tear.
Yeah.
And it's like if you've never had to experience it, you don't understand it.
Absolutely.
And I've been fortunate in my life, but I still say to people, you don't know what it feels like. You can't understand the stress of if I go into a store and there is, a white person that works there, a clerk or whatever, and she doesn't ask, what do I need or help? And then she asks a white person that walks in. I have to sit there and try and understand, okay, did she not wait on me because I'm Black or did she just overlook it? And I have to deal, and that's a stressor because then it's like,
stressful.
I feel angry. It's like, how am I going to deal with this? And a lifetime of those little, what we perceive as microaggressions really impacts your health because we know the impact of stress on your health. Causes
so
increase in
true.
cortisol levels, the effect of cortisol. And when you live your life dealing with those little microaggressions and then these other things that impact your health, that's what the weathering effect is that eventually it wears your body down.
It does. There's this erosion. Welcome to Get Real with Alexis Jones. On this podcast, we'll dive into real relationships with real people guided by the wisdom and perspective of some of the most seasoned voices in our community, our beloved seniors. Each week, we'll unpack the joys, challenges, and lessons learned about love, family, friendship, and everything in between. This is a space for heartfelt conversations, eye-opening truths, and powerful stories that will inspire and challenge the way you think about relationships. We're keeping it honest, unfiltered, and deeply meaningful. So settle in and let's get ready to get real. Let's jump in. Welcome to another episode of Get Real with Alexis. Today, our topic is living longer and stronger. We are addressing seniors in particular today, but if you're not a senior, it's still good information. We're tackling an important topic that's often overlooked, the leading causes of death among seniors, and particularly the unique health disparities affecting older Black Americans. Here is some sobering information. Nationwide, the top 3 causes of death for older adults are heart disease, cancer, and unintentional injuries like falls. They're followed closely by stroke and Alzheimer's disease. For Black seniors, the burden is even heavier, and we'll get into why that is a little bit tonight during our discussion. See, it is nighttime here. Heart disease, cancer, stroke, diabetes, chronic lower respiratory conditions dominated the list in 2014. Some more information for you. And while seniors age 65 plus die most often from falls, white seniors account for 87% of those. So they tend to fall at a higher rate than Blacks. In fact, Black seniors remain notably lower when it comes to falls and deaths from falls. These numbers remind us while aging brings common health challenges, the risks are often greater and more complex for Black seniors driven by systemic inequities that have accumulated over a lifetime. And you're going to hear more about that in a few moments. So, to help us take a deeper dive into the numbers and all these concepts that I just wanted to introduce to you, I'm glad that I have my friend and my co-host, Dr. Kim Redding, with us back again. Thank you for hanging out with me once again.
Well, thank you for having me. And I always enjoy coming here. And this topic for me as a physician is particularly important. And it's so important that I brought my notes with me today because I want to make sure that I cover everything and then I'm really sharing accurate information for our listeners. So,
Yeah,
this is an important
yeah.
topic for me to
She's
have
got
my
notes.
notes.
She's got notes. So you better tune in, sit down, don't miss a thing. Kim, earlier we were talking about there was a statement here that made me think of something you mentioned early. It says, the risks are often greater and more complex for Black seniors, driven by systemic inequities that have accumulated across a lifetime. So we're going to get into that. And you mentioned an interesting concept called weathering.
Yeah. And so even before that, so the weathering effect, I find it absolutely fascinating. But that was probably, the early 90s or so when that term became popular. And a lot of people are like, what is the weathering effect? And so it really, I want to make sure that I share this. And so when I look this up, it says that the weathering effect is one of the most profound and under-discussed concepts in public health. And so, in addition to my MD degree, I have an MPH degree, a master's in public health. So I am so engaged, and I think public health is such an important field of study. And so I did a lot of years working in public health. And so one of the things, and I'm going to get to the weathering effect, that of a light bulb moment for me when I was getting my master's in public health was this idea of the social determinants of health. And so I was like, what are the social determinants of health? And so it was really the concept that it's not just about health care that impacts populations, people of color, underrepresented populations, but it's really all of those other things that we have to deal with and that people of color deal with that impact their health. And so nobody really thought about that. Everybody thought it was just, whether you can access a doctor, whether you have a primary care physician. And so studies have shown that only 10% of your health outcome is due to the healthcare system. And the other 90% of your health outcome are due to these social determinants of health.
Really?
Yes. And so what are we talking about? So we're talking about your economic status, where you live, educational status, all of these other things are more impactful to your health than the actual access to the healthcare system. So this whole idea of social determinants of health is really important. And so when we start talking about health, even before you become a senior, these social determinants of health are really important. So there are these social things that impact your health.
So you mentioned where you live. How does that impact?
So, for example, what you have access to in your community. So we know whether or not there's a grocery store in your community impacts your health. And so there's so many studies that have identified food deserts. So places where people don't have access to a grocery store. Now, you and I take that for granted because we live where we have our choice of grocery stores. But the idea that there are communities where people don't have access to fresh fruits and vegetables.
Yes.
So when we start talking about how important it is for people to eat healthy, if you live in a community where you can't buy fresh fruits and vegetables, or if they're available at like a convenience store, they're either not good quality or they're so expensive that you can't afford it, that impacts your health. And so again, we know that that's important. The other is like exercise. So we tell people, get out and exercise. But if you live in a community where there aren't sidewalks, how are you supposed to
Mhm.
exercise? So you walk along the side of a busy street and you really put
And it's
yourself
risky.
in
Yeah,
harm's way
absolutely.
because there's no place to exercise. So when you go to a physician or a doctor and they tell you they want you to eat healthy and exercise, but they don't consider your environment, they don't consider your community, then it's not even possible for you to
Right,
do those things
right.
that benefit your health. And
That
so
is
all those things are social determinants of health.
Yeah, that is so interesting that you brought that up, and I'm glad we're talking about it because it's so true. As you were talking, I'm thinking about the farmer's market from us is about 1 mile away. We could walk there if we wanted to. Whole Foods, same thing. And then we have, like you said, our choice of grocery stores where we can get fresh fruits and vegetables, right? And we can comparison shop and see if we can get the best bang for our buck. But if that's not available, how can you lecture your patient about eating healthy when they don't have access?
Exactly.
And the other thing that happens in a lot of communities that don't have these resources is they have fast food. They have fast food.
Right.
And you can get a super burger or whatever you want to call it and double it, supersize it and all that, 2 for $1, 5 for $3.
Exactly.
And so now you've got these few dollars that you can buy this fast food that's full of salt and grease and maybe not even real meat. And you can feed your family because it's
It's
affordable.
affordable because even in some of these communities, if they have access to a grocery store, but if the prices are so high that the cost for me to buy these groceries to prepare a meal is cost prohibitive, but I can go to McDonald's or Church's or
Mm-hmm.
Kentucky and buy a big thing of chicken and
Yes,
feed my whole family. What do you think I'm going to do? What
absolutely.
choice do I really
You don't have a
have?
choice.
You really don't have a
Mm.
choice. And so again, sometimes because even like I'll go to the grocery store and I wonder, well, why is this healthy choice so much more than this processed food choice? So
Absolutely.
even when you go to a grocery store and you have a choice or you have options, you realize, but it's more cost effective to me to buy this more highly processed food than it is this fresh whole food.
Yeah,
And so again, you really wonder, is there really choice here?
yeah.
Do people really have that option and the opportunity to eat healthy, to live healthy? And so again, these social determinants of
Mhm.
health, there have been other studies that have been done that show that educational status is a strong predictor of health and health outcomes. So again, because if people are not literate, how do they even know how to read health information? How do
Yes.
they take ownership of their health information? And so
Mhm.
there have been a lot of studies that have shown just literacy, educational status is significantly correlated with health
Yeah,
outcomes.
that
And so
makes
again, we
sense.
don't think about all these other things and
Mhm.
then we want to blame people because they aren't making the healthy choices.
Mhm.
When do they really have that
Right.
opportunity? The other thing is, insurance, the
Mhm.
cost of insurance, the cost of medicines and drugs. So if I'm someone and I've got to make a decision between whether I feed my children or whether I buy my high blood pressure medicine, what do you think I'm going to do?
Absolutely.
And so one of the things that, we've found is that a lot of times physicians who don't understand the challenges and the social determinants of health because it's not taught in every medical school and it's not taught everywhere. And I graduated from medical school and I didn't really learn about it till I was getting my master's. But now
Really?
more and more medical schools are teaching it and understanding the impact, these
Mhm.
social impacts on
Mhm.
people's health. But again, if a doctor, gets frustrated with their patient because they're not taking their blood pressure medicine, have you ever considered that maybe I don't buy it because it's expensive and I got to make a decision between whether I buy food for my children or whether I pay my light bill or whether I pay my
Absolutely.
rent? And
Mhm.
so if I as a patient have to make that decision, what decision do you think I'm going to
Mhm.
make? And so again, it's understanding that the challenges that individuals face, it's not a lot of times it's not a choice that they
It's
have.
not a choice.
So this social determinants of health really feeds into this whole idea of the weathering effect.
Mhm.
And so I wanted to make sure
Mhm.
again that I'm talking about this and really clear about what this is. And so this public health researcher, Dr. Arlene Geronimus, I hope I'm pronouncing her name correctly. And this was a concept, this hypothesis that she developed in the 1990s. And so the weathering effect is it describes how chronic exposure to social, economic, and racial stressors lead to premature aging and increased vulnerability to disease. And so when you think about African American, Black populations, and other marginalized populations, that effect is cumulative over a lifetime. So again, when you've spent your whole life having to deal with systemic racism,
Yeah.
dealing with these social determinants of health, then it's kind of like this cumulative wear and tear on your body.
It's wear and tear.
It's wear and tear. And
Yeah.
it's like if you've never had to experience it, you don't understand it.
Absolutely.
And I've been fortunate in my life, but I still say to people, you don't know what it feels like. You can't understand the stress of if I go into a store and there is, a white person that works there, a clerk or whatever, and she doesn't ask, what do I need or help? And then she asks a white person that walks in.
Mhm.
I have to sit there and try and understand, okay, did she not wait on me because
Mhm.
I'm Black or did
Mhm.
she just overlook it?
Mhm.
And I have to deal, and that's a stressor because then
It's
it's like I
stressful.
feel angry.
Yeah.
It's like, how am I going to deal with this? And a lifetime of those little, what we perceive as microaggressions really impacts your health because we know the impact of stress on your health
Oh,
causes
so
increase in
true.
cortisol
Yeah.
levels, the effect of
Yeah.
cortisol. And when you live your
Mhm.
life dealing with those little microaggressions and then these other things that impact your health, that's what the weathering effect is
Yeah.
that eventually it wears your body
It
down.
does. There's this erosion, right, that happens, and sometimes we're not even aware of it. We're in this fight. That's what it feels like to me. We're always in this fight for ourselves, for our families, trying to make sure our children are treated fairly and so that we can arrive at a certain place. But it's a fight to get there. And if you bring up anything having to do with race, then you're accused of playing the race card.
Exactly.
And all we really want is to be treated fairly. And when it doesn't seem like that's what's happening, it's stressful.
It's stressful. And if you've never had to exist in that world, you can't possibly
You can't
understand it.
understand.
You just cannot understand it. And when you talk about the fight and flight, I mean, that's real. So our body is in this constant state of stress. That's why our cortisol levels are so high. I mean, and high cortisol levels cause increased blood pressure. It leads to problems sleeping. I mean, all of these things that are
Mhm.
associated
Yeah.
with it that your body just can't exist. It
Mhm.
affects your cardiovascular
Mhm.
health, your mental health. And so, again, it's like these are real
Yeah.
issues that,
Yeah.
African Americans and other marginalized populations deal with.
Absolutely.
And it impacts your health. So you imagine as a senior, by the time you get to your golden years,
Mhm.
you've had a
Mhm.
lifetime of dealing with
Mhm.
that and being in that constant state of stress. It's really, I mean, it's real.
It's real.
It's real.
It's real.
It's really real. And so again, there's this other concept that's called the allostatic load. And that just speaks to kind of the effect that this wear and tear has on your body. And so again, it talks about how this chronic stress leads to, again, high blood pressure, insulin resistance, this state of inflammation, which impacts cardiovascular
Mhm.
disease and lots of other health issues. And so, again, it's also associated with premature aging of your cells. So, again, all of this, has been shown to impact, people that have to deal with this, African Americans, again,
Yeah.
people,
Yeah.
in marginalized populations. And, we don't have the luxury of not having to deal with this because this is
Right.
the
That's
reality.
the reality for us.
us.
Yeah, it
Yeah.
is. It's just the reality. And I wonder if I wish that when we talked about race relations, it just, Kim, it just reminds me, I'm going to go back a few years. When I first moved here to Georgia, I was teaching at an elementary school. And it was during that time that there was this big push and requirement that we do diversity training. The entire staff had to go through it. Um, and it was treated like, let's just check the box and just say we did that. Whatever was required, we did it in the spirit of, let's just hurry up and get this done with. Okay, week 1, week 2. Okay, we're done. Let's just forget about all that and go back to where we were. There was no attempt to really understand each other. And I remember some, really good friends, this one white teacher, I really liked her a lot. And she acted as though I felt like that too. Like I should have felt like, yeah, let's just get this over with and move on. I didn't feel like that. I really wanted you to care enough to understand what I was feeling and what I've been through and what I've got to go through. And not just when I say I mean these children that we're trying to
Right.
teach. Because they walk through the door, you're talking about going back to weathering, they walk through the door and they may not be as neat as another student. Or even if they are, the hue of their skin causes you to already form an opinion about them before you even get to know them. And so when I know that is happening as a parent and as an educator, I'm trying to make sure that my kid gets a fair shake, gets an opportunity, the same opportunity as all the other kids. So this fight started for me as a kid, and my mom is trying to protect me. And now I'm doing it for my children. And I don't have the luxury of just, happily, joyfully, and without stress sending them off to school. And we used to I remember teachers would get upset about those Black parents that didn't show up for some of the parent-teacher meetings and all that. Some of those parents are working 2 jobs.
And don't have the kinds of jobs that afford them the luxury of being able to leave in the middle of the day and go to
Absolutely.
these events.
Right.
If I've got to punch a time clock and if I'm not there, I don't make money, and I'm trying my best to make ends meet. What do you think my choice is going to be? As much as I
Absolutely.
want to be there, it's equally or more important for me, for my child, to make sure I can pay the bills or that I can
Right.
put food on the table. And
Absolutely.
so it's not because of lack of want. It's
Mhm.
that I don't have the kind of job that allows me that. Even, some parents not able to take their kids to the doctor because, the pediatrician's hours are 9 to 5. Well, that's when I work. My
Right.
boss ain't gonna let me leave to take my child to the doctor. So it's not that I don't care about my child. It's like the system is not set up
Yeah.
for my success.
Yes.
And so I
Yes.
think,
Yes.
that in healthcare in some communities, there's that recognition. But I think for so long, nobody really thought about that. And they made assumptions about people and individuals based on these standards or norms that did not reflect the reality of their lives.
And that's what I wanted in this situation, other staff members to understand, to want to understand about me, about our children, about the obstacles that we're facing and trying to overcome, just because we want our kids to have a good life too.
Right. And I think now, and I don't remember this being as prevalent when I was growing up, but the unhoused, there's so
Yes.
many children that are unhoused,
Yes.
that are coming to school from shelters,
Yes.
that are coming to school from the back of their mother's car.
Absolutely.
And so they may come to school and their clothes may not be as fresh or clean. They may be wrinkled. Where are these children supposed to wash?
Mm-hmm.
There's not even a washing machine to wash their
Mm-mm.
clothes. Some of them don't even have a place to take a bath or, brush their teeth or whatever. And so I think that this is a bigger problem, unhoused families, whole families that don't have a place to live. And yet these kids are coming to school. And so
Yeah.
I think when we as a society don't understand that, it's a problem.
It's a problem to not understand and even not to care.
Right. To not
To
care.
not care.
To not care. To not care. And I think that's what's so
It's heartbreaking.
it's heartbreaking. It's really heartbreaking, and that we just are so quick to pass judgment on someone or
Oh, that
someone
parent
else.
doesn't care. They never
Right.
show up.
And so again, when we talk about the health effect of seniors, it's a
Mhm.
lifetime
It's a
of that.
lifetime of
And
that.
then we wonder, there were studies that looked at literally within the same city, different zip codes and the difference in life expectancies based on your zip code.
Mm.
Based on your zip
Mhm.
code, your
Tell us.
life expectancy was
Yeah.
less because of where you lived.
Yeah.
What does that say
Yeah.
for the weathering effect, for
Yeah.
social determinants of health?
Yeah.
There have been studies that have shown that, and it's impacted by all the things that we're talking about.
It
What you have
is.
access
It
to,
is what you have access
level of
to.
education,
Yeah.
what's available in your community. So that's really important. I think the other thing that is not often talked about, but it's even within the healthcare system. Again, this whole concept of implicit bias is
Mhm.
extremely important in
Mhm.
the realm of healthcare.
Mhm.
And so implicit bias are biases that we have that we're not aware of.
Mm.
And they're biases that develop over a lifetime based on what I'm exposed to, what I see. So and the important thing is that we recognize we all have them.
Yes.
And so you got to recognize you
Yes.
have them so that you can be aware of them and act differently in spite of those biases that you might have. But some biases, for example, that happen within the healthcare system is the idea that uh, people of color, Black people, have a higher pain tolerance. So there have
Yes.
been so many studies that have shown that as a Black person, if I go to an emergency room and I'm complaining of pain, they think I'm drug seeking
Mm.
or, oh, I'm not really in that much pain, And so again, my pain isn't addressed in the same way. And again, it's that implicit bias that healthcare provider has
Yeah.
because they've already decided that for me to complain, I really have an ulterior motive behind that. So this whole idea of implicit bias.
Do you know where that came? I know that that's true, but do you know where that came from, where Black people can tolerate more pain?
I don't know if it goes, I have no idea. I
I
really
can't
don't know the
imagine.
origins of
I
that.
can't imagine.
Yeah. But I do know that.
Is it because during slavery we were whipped?
Maybe so.
It did hurt.
Mhm.
It did hurt.
Yeah.
I don't know. Do you think that didn't hurt a lot?
Exactly.
Yeah.
So I don't know if it's.
And did it not hurt when if our children were taken from us or our husbands or our wives? We do hurt.
We do hurt.
But that's why we have to care and we have to try to get an understanding. We have to take the time to do that rather than just dismiss it and say, she doesn't care or they have inferior brains.
Exactly.
Inferior brain development. So they will never achieve here.
Right.
Well, I want my audience to know Kim is an MD. So that just erases that concept or that bias right there. But this is real.
It is real.
This is
Other
real.
things that are important to understand too, for example, and this is one of those kind of statistics that just blows my mind. So white women are diagnosed with breast cancer at higher rates than Black women, but Black women die at higher rates than white women. So in my mind, it's just kind of like, okay, how does that happen? So again, these systemic issues that white women within our healthcare structure have more access to detect breast cancer. And we all know that if you detect breast cancer early. You survive it. The chances of surviving it are much greater. And then they have access to treatment for breast cancer, whereas Black women, we don't diagnose it because we're not looking for it. And then when we diagnose it, our access to treatment or we're at advanced stages. So our survival rates of breast cancer are lower. So you tell me
Yeah.
that there aren't issues of disparity within our healthcare system. And so there have been studies that document that.
Yeah.
And so we know that to be factual, not just something that I think, but that has really shown that
Right.
to be. So again, I think that just points to the inequities that we see within our healthcare system that and the contributors is multifactorial. It's not just one thing.
Mm,
We talked about the social determinants of
mm,
health. We talked about the weathering effect. And then we talk about implicit bias and
mhm,
biases actually within the healthcare system.
mhm,
And so
mhm,
there's a real push to look at how to standardize treatment and care because of the reasons that you have Blacks, people of color that come in that literally receive different care
mhm,
for the same
mhm,
presentation, clinical presentation than others. So hospitals have really been pushed to look at that and
mhm,
make sure that there are standards of care
mhm,
that any patient that comes in with
mhm,
this, I can tell you like from my own personal experience, and I think I shared this with you when my father almost died at a
mhm, mhm,
hospital. And I truly believe it was because he came to the emergency room and he had a urinary tract infection. And they diagnosed the urinary tract infection. Then his partner, it was getting late and they had admitted him to the hospital, but they didn't have a bed for him. And so it was getting late. And so his partner left because he was there just waiting for a bed. And so this was probably around 10 o'clock at night. My
mhm,
dad at the time was probably 91 years old. So
mhm,
he's an elderly Black man
mhm.
in this hospital that is a predominantly white healthcare
Yeah.
system. And so they admitted him. And then my take on it is they forgot about him. And so he was kind of pushed aside at 10 o'clock. Urinary tract
Yeah.
infection. You can give antibiotics for a urinary tract
Right.
infection. It wasn't until around 7 or 8 o'clock the next morning when I am surmising that they were doing their rounds in the ER that they found my dad unconscious and
Oh my
unresponsive.
goodness.
And that's when I got a call here in Atlanta. My dad is in Kansas City, Missouri. And that's when I got a call here that they were rushing my dad to the ER. Now, mind you, he had also, when he first got to the hospital, he was so sick and so weak till he tried to go to the bathroom and he fell. And so then they saw that on his record. So they're rushing him down to the CT scan, wondering if he has a brain bleed. Now, mind you, that was 12 hours ago that he fell. And so they're rushing him there, but he's unresponsive. And then they rush him to the ICU. He didn't have a brain bleed. And it wasn't until they saw him at 8 o'clock in the morning, looked at his chart, that they realized nobody had ever given him any antibiotics when he came in. So he had been admitted in the ER for 12 hours and he had never received an antibiotic. My dad was septic and he was near death. And they rushed him to the ICU. And then he ended up spending 5 days in the ICU, then in the hospital. He almost died because he was left forgotten, you
Yeah.
know. And I couldn't help but think, this elderly Black man kind of got pushed to the
Yeah.
side and nobody thought to come and check on him.
Yeah.
I'm like, how did in the whole from 10 o'clock at night to 8 in the morning, nobody thought to go check his vital signs, to take a temperature, to take a blood pressure. He was just pushed
Mm.
aside and left, and my dad almost died. I am thankful that he survived
Yeah.
and he's doing well, but the idea, and so my thing is I can only imagine that if it happened to my dad, it's happening to Black people all
Mm.
across this country
Yeah.
where they are being forgotten,
Mhm.
in situations like that,
Yeah.
within our healthcare system.
Yeah.
So again,
I told you about this when, my audience knows that my son Herman passed away in January of this year. But when he texted me, he had been complaining to his brother about shortness of breath. I didn't know until Christmas, December of 2024. And he picked me up to take me over Brandon's home, his younger brother, for Christmas. And he just wasn't feeling well. You could tell because he wasn't as playful. He always plays with the kids and all that. And he just wasn't. And when it was time to go, he just disappeared. We were in the room where we were watching a movie, and he disappeared and put his clothes on because we had on our matching pajamas and put his clothes on, and he was pacing the floor. And I was just alarmed by his demeanor. But I said, well, are you ready to go? You ready to go? And yeah, I'm ready to go. I said, okay, okay. So we rushed. I rushed so he could bring me home so he could go home. But he wasn't complaining to me. He just needed to get home. And I wish he had complained because I would have taken him. So a couple days later, he was at work and he wasn't looking good. And somebody even noticed it. But he ended up leaving and driving himself to emergency. And he texted me to say he was in emergency, and they said he had pneumonia in his left lung and that he was going to do an echocardiogram that next morning. So I went that night and I sat with him until he was tired. So I said, I'll be back in the morning. And I went back early that morning. They had done the test and, his heart was okay, but he was having trouble breathing. And they even had an oxygen tube, not a down his nose. Is that, yeah, the tube down his nose. And so, and he was having trouble because it even showed up on the machines. But the doctors decided to give him a prescription and send him home. And I'm not a medical professional. All I know is he looked sick and he couldn't breathe. He wanted to leave. He was like, I need to get out of here. I got to go to work. And I said, I don't think you're going to be going to work anytime soon. He was thinking he could because that's another mindset. I'll talk about that in a minute. But that not only are we denied the same care, but we often deny ourselves that care because we're just used to having to, brush it off and keep going. Anyway, they discharged him, and I went to talk to the doctor that was on call there. And I know my son he was 46 years old. He's not a child. But I'm like, you're going to discharge him? And he can hardly breathe and and I was talking to him outside of the room because Herman would have said, no, Mom, I want to go home. But he wouldn't even engage with me. He was typing on his laptop and I'm standing to the side of him, trying to see, is this the right thing to do? Because, he's in bad shape and he's not going to come home with me. And he wouldn't even look at me. He wouldn't talk to me. He wouldn't look at me. So they discharged him. And within about 12 to 15 hours, he made it home. He went to the pharmacy. He texted me. He got home. He didn't text me, but I texted him. I said, are you home? Are you home? Are you home? And he finally said, yes, I'm going to rest or something like that. Then that next morning, because I'm worried, I didn't even sleep that night because of how he was when I left him. And I just didn't know why they wouldn't keep him in the hospital. But anyway, that next morning, I couldn't reach him. And then later on that day, as I've said before, I sent his younger brother there. And it was that day when we had that really big snow. We don't get that in Atlanta, so we get all excited about snow. But anyway, he found him and Herman was gone. And I just want to know, would you have discharged somebody else in that?
Right.
See, it makes us ask that question that you said.
Exactly.
Yeah.
That other people don't have to ask that
Yes.
question because that's
Yes.
the question I asked for my dad. If
Yes.
he had been someone other than this elderly Black man, would he have been pushed aside and
Right.
forgotten? Or would they have made sure
Yes.
that he was cared for, that
Yes.
they got his antibiotic order, that he got to his room because he didn't have to go to the ICU
Absolutely.
if he had gotten just antibiotics? We're not talking about something complicated. We're talking about antibiotics
Yes.
is what my dad needed. And he did not get that standard of care. I
Or
can't.
any care during
Right.
that window of time.
Right. And I can only ask, is it because he was a Black man? And other people don't have to
They don't
ask
have
that
to ask
question.
that. And if you ask it, they say something's wrong with you.
Yes.
And I had to ask that question.
Right. Would
Why?
they, if he had not been a Black man, Would they have, well, let's run some more tests.
Yes.
You don't seem well. I think something else might be going on. Would they have written a prescription and sent him on his way? And you
Exactly.
can't help but ask that. And so
Exactly.
again, the fact that we have to ask
We
that,
have to
what does
ask.
that do for us?
Oh my
What does
gosh.
that do for
Just
us?
having to ask the question is grueling emotionally. It
Yes.
just rips you apart that I have to consider, is it because my son was a Black man?
Right. Would the outcome have potentially
Yes.
been different if he were not a Black man? And that's something that you got to live with that.
Yes.
You got to live with that.
Yes.
And so the emotional toll, the physical toll
Absolutely.
that takes on you is
Absolutely.
not something that other people have to deal with.
Mm-mm.
And so again, when we talk about the weathering
The
effect,
weathering effect.
when we talk about
Mhm.
this stress that when we talk about the loss that you suffered, and then to have that question mark
that will
associate
always
be there.
Mm.
No one else
If they had done something different, would he be here?
Yes, yes. Especially because you questioned it. You questioned it and it was just dismissed.
And would you have dismissed anybody else besides me?
Right. You gotta
Me, the Black
Yes.
mother, you dismissed me. Totally. You wouldn't talk to me, nor would you look at me.
Yes.
And all I wanted was some answers because my child, 46 or no,
Is your
he
child.
is my
Yeah,
child.
and was sick.
And he was sick.
And you don't ever stop being a mother.
You never stop being a
never
mother.
stop being a mother. And so again, what that does to you, that you carry that always, the stress, the grief that you have had to carry, did it have to be?
Yeah, did it have to be?
Or was it because my son was Black and I was a Black mother? Other people don't have to ask that question.
And again, you said this before, and I just want to reiterate the toll that takes on me or mothers or fathers like me
For a lifetime.
For a lifetime. For a lifetime.
That's what we're talking about. That's what we're talking, and that's real. Those are real experiences. And the fact that we're sitting here and you're talking about what happened to your son, and I'm talking about what happened to my dad, and we're educated women, we are professional women. So if it can happen to us, imagine those that don't have that can't articulate things the way that we have, that don't have some of the advantages that we've had. If it can happen to both of us, you can only imagine what's happening to people who aren't able to, can't ask the questions.
Yeah. They can't ask the question.
Right. And they just have to trust.
They're trusting.
That someone.
They're hoping and trusting.
That you have their best interest.
Yes.
That you're going to do everything you can do in their best interest.
Absolutely. Absolute.
Weathering. It is real.
And it does just erode mentally, physically, emotionally. It just seems to wear you down.
Yeah.
And you sometimes feel like giving up, but you have to keep fighting.
Yes.
And it's exhausting.
It's exhausting. It truly takes a physical toll.
Yeah.
It takes a physical toll. It's exhausting. It's exhausting. And sometimes even like this political climate we find ourselves in, it's not impacting everybody the same way. Because at the end of the day, I can't ever not walk in a room and people know I'm a Black woman.
Right.
And when there are things that are specifically targeting me as a Black woman, I wear that. This is who I am.
Yeah.
I can't be anything other than who I am. You can be someone else and people don't know if you're Democrat, Republican, other. So, you don't carry that with you, which I'm not saying that other people run from who they are, but it's not like you walk in a room and everybody knows, oh, you're this, you're that.
Yes.
So those of us that are being targeted or impacted, that we can't run from who we are or we walk. Imagine, do you know the toll that takes?
Oh my
that
goodness.
in addition to everything else,
Yes. In addition to.
so that's not just that.
Mhm.
It's in addition to
Mhm.
everything else.
Mhm.
So this is not a new phenomenon for us. It is just, okay, now in addition to everything
Yeah.
else, here we go.
Uh,
Here we go.
you get tired, Kim.
It
You
wears you
just
down.
get tired. And I think what and you can tell me what keeps you going. One of the things that keeps me going is I keep thinking, okay, I have a younger son and I have 5 grandchildren and I have to keep fighting. I have to keep fighting. I have a brother who's like a son because he came to live with me when my mom passed away. But they need me. They need me. And I'm tired. I'm just tired. When I watch the news and I see what's being taken away, not just from Black people, but from those that are disadvantaged. I mean, and you do it so easily. Do you understand the toll that it's taking, even the threat of it?
Even the threat of it.
And if I'm making a minimal salary and you say I'm going to lose 1,200 more dollars, if my salary is minimal, that's a lot of money.
Hmm.
Cause I'm really stretching. I'm really stretching to make ends meet. So I can't afford to lose another
Right.
grand, you
So
know?
I think, what we're facing in the current climate has a greater effect on certain populations than
Yeah,
others. I think it really does. Like you said, those that marginalized populations, those
yeah,
that have already are starting with less and then having to navigate this. Those
yeah.
of us that already just deal with issues of bias and
Mhm,
racism,
mm,
that have to walk through life asking those questions
mhm,
at each encounter, because I
mhm.
can't not wonder if something has happened to me or somebody has treated me a certain way or not done something for me because I'm Black, because
Yeah,
that's the lens through which I walk through life. I just,
mm,
and to try and act like racism doesn't exist or the color of your
mhm.
skin doesn't matter in this country is grossly naive and inaccurate because it
Absolutely.
does.
Yeah, it's absurd. I mean,
Mhm.
it just is. And that's the question. Those are the conversations that we have. Those are the questions that we ask. We try to encourage each other or we vent to each other. These types of conversations that other people don't have to have at their kitchen table.
Don't have to have. Even when you talk about, and it's still conversations that, and I'm sure you as the mother of a son, like with your boys were, young, you had to
Hmm.
have those conversations with your
Yes.
sons
Yes.
about going out, encounters
Hmm.
with the police,
Hmm.
praying that they make it
Oh, they
home
make it home. Oh
at
my
night,
goodness.
those are conversations. Not everybody has to have those
No, you don't have to have those
conversations.
conversations.
Right, you don't have to talk to your son when they walk out the door, how to behave,
Or
what
your
to do.
blood pressure doesn't go up
Yeah,
when they walk out the door. And oh my God, when they started driving, then you have that conversation about don't drive like this. Don't give anybody
a
a
reason,
reason to stop
and then
you.
if they do,
And if they
here's
do,
what you
here's
do.
what you
You
do.
he
There and the kids are there, okay, mom, this is what they say. And I'm so serious. For me, this is life and death.
Yes,
And you're just like, mom, okay, mom, okay. They're like, you making a big deal out of it because they don't even understand at that point
right.
in their lives. And so when my boys started driving, it's like we had a car because they were involved in so many after school activities. So Herman was the oldest, so he had the car first. And I said, you can't drive anybody else. You can't take a friend in the car. And that was so hard because they're social people. But in my mind, I had this whole scenario about you get a friend in the car and then you all gonna start laughing and talking and you're gonna turn the music up and you're gonna be having a good time. And the police is gonna pull you over for some reason, you know. And then he pulls you over and maybe not you, but maybe your friend or somebody gets smart with him or
Yes,
says something he doesn't like. I mean, I had the whole scenario played out to the point of, okay, get out the car. I mean, and they didn't understand this. So Brandon, the younger one, Herman was pretty obedient. If I told him not to do it, he wasn't gonna do it. Brandon would kind of, he he might push the edges a little bit, but this night he didn't. I didn't learn this until lately. I said to him, "You can't have any friends in the car." Brandon was really social, and he had lots of friends, and they stayed after school and they played football. And they, "Hey man, give me a ride home." And I said, "You can't take him home because of the whole story in my brain about what would
Right.
happen." And so he came. I got a call from a police officer one night while I was waiting for him to get home from football practice, saying he had been in an accident. I can't, can't even tell you what happened to me. I think I just fell to my knees and laid out on the floor. I just think I just like, I didn't get any details or anything. And I said, well, how's he doing? Well, I don't remember getting any assurance that he was okay. I don't remember that. If they gave it to me, I didn't hear it.
Right.
So the doorbell rang and I opened the door in fear, But Brandon was standing and it was a nice police officer. And he was in back of Brandon saying, I brought him home, the car he couldn't drive and all that. But I just remember the fear, I mean, I could have died. I was so shaken by just the phone call. What happened? Did he get into an encounter with anybody? Why? So
Weathering. Weathering.
It takes a toll.
It takes a toll.
And even when you think about it, you still get and even now, Brandon is married with a family. He's got 4 children. He's in his mid-40s. And I have this, those apps where you keep up with people when they drive, and he has it on me. I want him to know where I am in case, he has a wife and, so he's covered, but he's on my list, a contact list as well. And so he's driving all the time. And I know he's not in high school anymore. I'm saying, does he have to drive so much? And I want to remind him of the talk.
Yeah. Yeah. Because in your mind, the threat is still there.
The threat is still there.
He's still a black man.
He's still a black man.
He didn't suddenly change.
No, he didn't change.
He's still a black man.
So
the
my
threat
worries
is
are
still real.
Yeah. My worries have not changed.
They have not changed. Yeah.
So weathering.
So,
going back to our intention, we really want our audience to understand what the contributing factors are to poor health to good health, and that they, as you've so clearly outlined, have more to do with, did I get the right prescription? Did I keep my annual wellness visit? And all those things, which are vital, but there's so many other contributing factors that need to be considered and talked about.
Yeah. And so we think about those as kind of the upstream things that need to be dealt with. And so the analogy is, somebody is in the water drowning, and so you throw them a life preserver. But the goal is to keep them from falling in the water.
Absolutely.
And so you put the guardrails, you put the things upstream to keep them safe, and you don't wait till they get in the water and then you're looking for a lifesaver to throw to them. That's when we have to really understand all of the things that impact health in our golden years.
Yes.
And so what do we do? How do we make those societal changes, and how do we impart that understanding so that people realize what are all these things that are contributing to poor health?
Yeah. And
So
in terms of what seniors can do, I'm sitting here thinking, especially at my center, we have people from the community come in all the time. I think when you and I have this kind of conversation, and hopefully there are others going on, that we can give our listening audience some questions to ask, because you have a deeper understanding of what's contributing to my health, the health of my family. And so what resources are out there? What are you doing about this, right? Not just, are the cost of my prescriptions going to increase? Because there's much more. There are many more questions that we need answered.
exactly. And I think when you think about like all of these contributors, that's why it's so important that we vote, that we
Mhm.
put the right people in our elected offices and leadership positions, people that are really going to help improve your quality of life, your
Yeah.
communities, provide resources for you, prioritize these things that impact health. And so I
Yeah.
think all of that, that's really important because it's not just whether or not I have a doctor, it's
Mhm.
all these other things in my
Mhm.
community that contribute to it,
Mhm.
health.
Yeah.
So the connection between mental health and your physical
Yeah.
health, but again, all of these factors also
Mhm.
impact your mental health.
Mhm.
So we can't
Mhm.
think of that as something separate.
Mhm.
Um, it's equally as important, and
Yeah.
many of the factors that contribute to physical health also impact your mental health. And so talking about that
Absolutely.
is really an important topic too for us to
Yeah.
talk about and
Yeah.
address.
And we will hopefully maybe in our next time together because, Kim, in our community, especially historically speaking, the generation before me, and even sometimes my generation, we didn't talk about emotional mental health. We didn't. It's like, just get yourself together.
Mhm.
If you went to see a psychiatrist or any kind of therapy, you were crazy.
Right.
You had to be crazy.
And we thought we should be, we thought we should be able to pray our way
Right.
into,
Right.
healing any
Right,
mental health
exactly.
issues we have. But it'd be the same thing like saying, I'm going to pray this high blood pressure away,
Right.
or I'm going to pray this cancer away.
Exactly. Still,
Mental health,
it's a
it's
sickness.
a physiologic illness
Yes.
just like anything else. And I
Yes.
think for whatever reason, we've not thought of mental health
Yeah.
in that way, but it really is.
It is.
It's treatable,
Yeah.
it's
Mm.
manageable, but it's real.
Yeah.
It's
And our
real.
faith should not preclude us from getting the help we need, no
Exactly.
matter what that help is.
Exactly.
It should not.
Exactly.
Think that, just like God uses doctors that take care of our physical needs, he uses others to take care of we are a whole being with a lot of things going on. The bottom line is get the help you need.
Exactly. Exactly. When we talk about, our organs, we see cardiologists for our heart and our
Yes,
lungs and our GI tract, and the brain is the most complex organ of
exactly.
them all, but yet we tend to neglect it
We
the
neglect it.
most.
And the thing is, if I'm off here, I can't take care of anything else.
Exactly.
I can't even think straight.
Exactly.
I can't even remember, right? And so I get help when I need it. There's no, as they say, shame in my game.
Right.
Whatever the help is, if I have the resources, I will get it.
Yes.
I will get it because sometimes in life, things happen to all of us, and there are crossword roads that we can get to, and they're difficult to navigate. First of all, we can't do this journey called life alone. And we'll talk about that too, because a lot of times seniors are at home alone all day, every day, and the only thing they have is the television, right? But we need each other. We do. That's a part of having good health as well. And so we have a lot to talk about and we will.
Yeah.
We can't we can't talk about it all tonight, but we thank you all so much for joining me and my co-host Dr. Kimberly Redding. I so enjoyed talking with her. You should be a fly on the wall. We have a lot of good conversations.
We do. We do. This is just
Yeah.
a snippet into
Just a
the kinds of
snippet.
conversations that we
Yeah.
have.
Yeah. We might figure out all the problems of the
I'm
world the way
telling you.
but we're going to try to share with you as much as we can because I want you to be your best selves and we want to be our best selves. So we're going to continue to help each other. Thank you so much for joining us and we'll see you next time. Bye.
Bye-bye.